My name is Paul Frank Vanek Jr., MD, FACS. I'm a board-certified plastic surgeon and a board-certified general surgeon. My philosophy of care is to be available to patients, to provide them the best care I can give. I have a team approach with my hospital staff, with my office staff, and I think I integrate the elements of personalized care with technological ability and availability of modern techniques. Say hello, everybody.
Hi.
Here's all my packing nurses. Are they marvelous?
It's my big break.
My name is Georgi. I live in Osceola, Wisconsin, and that's about 45 minutes northeast of Minneapolis. My daughters are 19 and 24, and we are the Three Musketeers. I mean, we're so incredibly tight. So I called them to come home. They came home in tears, I had told them, and I just had to lighten it up somehow. So I named the thing Earle. My tumor's name is Earle, and we sing the Dixie Chicks song, Goodbye Earle, to it. I had a spot that was tender and I was suspicious about, so I went in to get a mammogram. I got a phone call the next day saying, you need to come back for an ultrasound. During the ultrasound, they said we need to do a biopsy. 2 days later, got the phone call from the radiologist. She just said, you have cancer. We're waiting for the test to come back. She expressed her condolences, and that was about it.
Hey, Georgie. Georgie's a sweet person I met some years ago, and she contacted me for some advice on breast reconstruction. It's a very emotional thing to get a new diagnosis of breast cancer. So my discussion with her was specifically about how we're going to manage not only her cancer, but how to reconstruct her in a way that really makes her happy.
You get a diagnosis like this and you just sit and think, what in the world is the right thing to do? And it has been a godsend for Dr. Vanek to tell me it's going to be okay and this is what we need to do for you, and to explain everything and how it's going to impact my life. I am so active. I think the thing that is the most frightening about everything I'm going through right now is the fact that I'm going to have to sit for a while. I ride cutting horses and reined cow horses, which is like a performance type horse. Is very intense and a lot of core muscle and a lot of upper body muscle.
When Georgie talked to me about what her physical requirements were, riding a horse, running through barrels, getting on and off a horse is very strenuous. One of the things that came to my mind is it sounds like she's a perfect candidate for a pre-pectoral single-stage breast reconstruction. Why pre-pec Alloderm breast reconstruction is such an exciting thing for me as a surgeon is I don't have to watch my patients undergo the painful expansion. The pain is a big thing for patients and leads many of them to choose completely nothing except a mastectomy and no reconstruction. Pre-pectoral means I'm putting the implant and Alloderm above the muscle, and that eliminates the very feature that is called an animation defect by reinforcing the soft tissues of the mastectomy flaps, putting the gel direct implant in a single stage. They're back in business with their incisions healed in a few weeks.
The fact that it was direct implant, the fact that it was pre-pectoral and not under the pectoral muscle, and the fact that it was nipple sparing, those were the three things that were super important to me.
I encourage her to actually come see me and explore the possibility of her doing the surgery with me, even though she lives quite far away. I think that's a doable surgery.
The thing that drew me here was the fact that I could do this direct implant thing and I could get back to my life in a timely manner. And also it was Dr. Vanek.
Hi.
Dr. Vanek is an amazing, caring human being. He has put my desires first as to what's important to me. He's made it clear that, you know, the cancer comes first, but that also it's important that I feel good about how I look when I'm done, and he's been amazing.
After we talked over her options in exquisite detail, she's going to have a single operation for the oncology portion of her breast cancer treatment, and at the same time undergo an immediate breast reconstruction using a material that gets incorporated into their body, gets revascularized as their own tissue, and it reinforces their implant reconstruction.
I've just completely put my faith in God and Dr. Vanek and all the people that are praying for me, and I just am hoping that I can just take this tumor that I call Earle and never think about it again.
So you got your horses in mind? You ready for your good dream?
I am.
Well, when Georgie undergoes her breast cancer operation, while she's going to sleep, she's going to have a board-certified anesthesiologist administer her medication. I'll be there holding her hand when she goes to sleep. All through the entire procedure, she'll have my entire team taking care of her and being mindful about her care. She's a patient that is likely to be able to go right to pre-pec with Alloderm reinforcement and then insert the implants that I pre-sized. I'll be able to go to the operating room with the plan of taking out her breast and her tumor on her right side, and then at the same time using a Syntaprobe to remove the single lymph node that is closest to her tumor. We test that, of course, for cancer, and that'll determine whether she needs radiation or chemotherapy. After that oncologic procedure is done, we do her left-sided simple mastectomy, and thereafter we do her bilateral pre-pectoral breast reconstruction. And we use a material that's called Alloderm, that is a tissue reinforcement to help support her breast mastectomy flaps. We put that implant above the muscle after we reinforce the tissues of her mastectomy flaps with the Alloderm material. The Alloderm material gets vascularized and incorporated into her body, and it gives a tissue reinforcement that makes the implant a more long-lasting and beautiful result. Then she'll recover with some drain tubes in for a few days and be able to go on her way in life. I'm very happy. Hi. Great news, huh? Yeah. I'm so happy for you.
I'm so happy for me too.
I really am. I'm so happy. It's such a great day.
You're the best.
Thank you.
This has changed my life. It's
So
renewed my
anyways.
faith. It's caused me to understand that people do love and care and do kind things. It's been a life changer.
For women who are facing a similar breast cancer dilemma as Georgie has, they should know that they have other options. With the innovation of Alloderm as a pre-pectoral breast reconstruction effort, we can do a single-stage procedure at the same time as their oncologic cancer operation. It will reduce their amount of recovery and get them back to their life more quickly.
It speaks volumes that Dr. Vanek and Lake Health are doing this procedure and no other plastic surgeons are doing it, and it's such cutting-edge technology, and it makes a woman's life so much easier, and you get back to your own life in a timely manner. Absolutely, I would travel 800 miles to see him again and again. Goodbye, Earle.
'Cause Earle had to die.